Okay. Thank you very much. Thanks for your invitation. And this is quite interesting group for me because I was in Reading around 2 years ago, and I met Mickey and in different places and conference, and I suddenly find that I have no idea why business school working for health project, but now I am working in business, working in medical school, but now I have a startup. Hope to share my journey. And and first of all, um, sorry, can you? Oh, this is my profile picture that start my startup. I have my startup, and I start to understand that some language from business school, and at the same time understand that why we do the big data, health analytics, digital health. But at the end, we need to connect it to our community through some social innovations or entrepreneurship program that to encourage people to use it. This is about my background. My basic training is a statistics now called data science, and got a PhD in public health and focus on epidemiology. I have 6 years working for clinical research, so I can speak some clinical language from the doctors. And also I work in a governmental department to handle some population data. And in the past 8 years, I work in an interdisciplinary team, work closely with engineer, data scientists, now business people, and at the same time, we still need to write, keep regular writing on the academic paper. Research interest is changing around different area from evidence-based medicines, digital epidemiology, and also big data. Before the lectures, I hear the sharing, I tidy up my slides. I just keep my research in smaller proportion so that I can share more experience, how we apply the technology to the market, and at the same time, how we use machine learning, become a product, but finally fail, and still we go for a product, how to encourage people to use it, hope one day they will enjoy our machine learning model. So this is a review paper, how we apply AI applications on hypertension management. And I have a product focused on hypertension management. So today I share more research on this part. This is a paper published this year. And why I write this paper, because I work with a group in Asia, and they find that they need someone to have some understandings on AI. So they invite us to write something on that. So this is a paper. The summary point is, even though we have AI, but how we use AI for prediction incidents, for management hypertensions, or even prediction with new technology like the sensor presented before. This is the coming up area that we can use for hypertension management with AI. But this is not quite straightforward, because AI people or data science people always keep thinking technology and data, but how we apply that to the patient. Around 8 years ago, we had already some blood pressure data set. Like Ricky's presentations, we are not focusing on one or two readings of blood pressure. We capture the long-term reading and focus on the variability of the blood pressure level, and use machine learning model classify into different risk factor. According to the BMJ, British Medical Journal, this is a method to identify the cardiovascular risk, in fact, beyond the average value of blood pressure. But we put this knowledge, know-how on an app, but the feedback is not good. So what's the global standard for blood pressure management? Before that, why we need blood pressure management? Because this is a kind of silent killer. It will increase the risk of heart attack. And why this is a blood pressure, high blood pressure increase the risk, because it increases the pressure to the artery veins, and at the same time, we need to do the blood pressure management regularly. So many people ask me why we don't use wearables, sensors, and other things to capture the blood pressure data. This is challenging because the doctors don't want to take the risk that they got a wrong reading. So at the moment, we still use the traditional way how we capture the blood pressure data through this kind of setting. And this is a guideline published 8 years ago. But the problem in Hong Kong is traumatic, because we have 7 million populations, and we have a millions of population diagnosis with hypertension. And unfortunately, we have another 14%, that is another millions of patients that they got hypertension, but they don't know. So in this figure, you can feel that we have around 2 millions of patients and it will increase continuously. How we can do a better management for the blood pressure will be a really important questions for us, for the researcher to handle. This is 3 years ago, we have a community care project. We set up this kind of device. Sorry, this is a little bit old traditional, but still work because in Hong Kong, we are quite close places and we put this kind of device in the community elderly center and encourage the participants go to the center, visit the social workers and capture the blood pressure data with this set of the device. And we almost cover the different part of the Hong Kong, and the participants number nowadays is over 15,000 already. So we have a regular body check mindset and encourage social worker to help them to do it. But unfortunately, after the 3 or 4 years experience, we find that this is not easy if we don't bring this technology at home. And at the same time, COVID-19, the social service was closed, locked down, and then the participants cannot see the social worker, and of course, they cannot collect the data. But anyway, the data equip us that we have more mindset to how to read our blood pressure data, including the trend, the seasonal effect easily to see, and at the same time, as I mentioned, the blood pressure variability. The variability shows important because we apply the same technique to study the spring cohort data set. This is about an American 100 multi-center trial. When we run the blood pressure variability with machine learning, we find some new story when we should use the intensive treatment. But this seems challenging because that data set may not have so many data points on the blood pressure data. But in this kind of system, we can build, and at the same time, we have more data by month or even by years to see the trend of the blood pressure. In Hong Kong, based on the machine learning classification, we identify about 1 out of 7 of the population have the high variability level. That means the high risk of cardiovascular disease. At the same time, if we don't use machine learning model in the old traditional method, they just use 1/3 as the high variability and another 1/3 is low. So this cutting may not be a good estimate. We may forget or even ignore some patients on risk. But still, you can see I already mentioned this is a bulky, and we need to use it in the community center. It limited by the opening hour and also no personal support. That's why we have another solution, HealthCap. This is around the day I started doing the machine learning, play around the blood pressure data, and we find the trend, we write up the hypertension articles, and we do believe that the machine learning understand the blood pressure variability level is important to our population. So we got the funding from the Chinese U, and we have a startup called Deep Health. I think this is the same concept of DeepMind, but I'm focusing more on the health. In Science Park as well, this is the place that we encourage the Hong Kong people to have a startup, small startup. This is Science Park. Compared with the traditional write on the paper, the elderly quite used. They are used to use this method to collect the data on the left-hand side, free of charge. On the right-hand side, the bulky solutions but accurate. Why don't we just put it on the apps? We use machine learning, image recognition. This is the place that we promote the apps. We just use a mobile, take a photo of a long Bluetooth device, and then the data will capture by image recognition and upload to our server. And this is a kind of in-between solutions when the poor people cannot buy the blood pressure, a Bluetooth blood pressure device. And at the same time, when they start to manage their blood pressure, they have no idea where to go. At least they can download an app. This is our product that promote to the market and through the startup. Of course, we also need to prepare the health report, the central clinical data portal, and at the same time, a family portal that they can compare with their family members. We start to build a network of the participants like this map. And you can see that we have a central portal worked under by the social worker, by the doctors, and also this system. I think we have a lot of discussion how we can handle this data connected to the hospital system. Now we are doing. This is about the art of business, I think, because first of all, we sell the technique, machine learning, see the classifications of blood pressure variability. No clinicians feel good because they are worrying that they don't know what is blood pressure variability and machine learning. So they have no intention to use it. But now we encourage the usage and encourage the users through the social workers, and also build a network from the family members. And at the end, we have a connected data set. Why we focus on the blood pressure data? For me, this is less sensitive than the clinical or health medical records. So we start this. Fortunately, we put a lot of effort, and at the same time, even though we write paper on some techniques, but this is not quite the language from the clients, then we promote it in another way: education, publication, public talks, and at the same time, maybe we also need to think when we have, for example, a future fast blood test for different kind of disease. The market and the model, how we run it smoothly, is also challenging. Maybe I speak this story so early, but we need to think far beyond when the product ready. This is the apps. This is the usage of our apps. In fact, this is the old data about 3 months ago. Today we have already 14,000 downloads, and the active users is about 6,000. And in the 6,000, and we have a regular BP records upload, and at the same time, we can capture the behavior of the user, how they use the apps. For example, they will regularly, for example, weekly click on their blood pressure reading and report in a PDF report and they will send to someone. And also, I got some feedback from the patient that they will bring the report in front of the doctor and let the doctor know that the distribution of their blood pressure like this. So this is the first step. We collect more data. And also the first step, likely this kind of business model seems work because some people use it. And now we need to think, or this is also a kind of experience sharing with the group and see maybe in the future whether we can bring the blood test to the Hong Kong and we can do similar things for Hong Kong people as well. I think that we have a long road to plan and also to discuss. But just a friendly reminder, this sharing this data only find 8% of the participants have a higher risk of hypertension. That means over 140 and over 90 of the diastolic blood pressure. This is a little bit beyond our expectation because in the statistics from the government, the high blood pressure, high risk of hypertension, the percentage should be around 20%, but we only got 8%. So the user profile, how we use your platform, in fact, this group is more healthy than the people who don't care about the hypertension. So this is a kind of experience sharing of our startup and also our research, and hope we have more discussions in the panel part. Thank you very much. This is Hong Kong.